Hello and welcome. My name is Sarah Rosendahl. I work in the Springfield-Greene County Library District's Community Relations Department, and I serve as Project Director for Death and Dying Conversations on End-of-Life Matters. On behalf of the library and the Series Planning Committee, thank you for joining us for this Death and Dying event, Advanced Care Planning with Pam Stoelzel from Respecting Choices of the Ozarks. This is our fourth year hosting the Death and Dying series, and we feel it's especially important that we offer the series this year to give people the opportunity to start conversations on these important topics as we face the challenges brought on by the pandemic. Bravo to those of you in attendance and being here to start the conversation. Thank you to the Hospice Foundation of the Ozarks for funding our series of virtual events, along with new materials about end-of-life topics for the library's collection. We value the support the Hospice Foundation provides for the Death and Dying series and other end-of-life projects in our community. We appreciate you joining us to help break the taboo of talking about death and start a community conversation on end-of-life topics. We hope this event and the Death and Dying series as a whole inspires you to continue the conversation that we start here with the people in your life. Our next event is End-of-Life Care, Social Model Hospice Homes and How They Work. That's this Thursday, November 5th at 7 p.m. The complete schedule of events and the titles for suggested reading are available online at thelibrary.org/death. The schedule is also in Program Guides and Bookends magazine available at all branches. Visit thelibrary.org/death or thelibrary.org/programs for a link to these virtual events. Before we get started with the presentation, a reminder that the library continues to offer programs for adults and children. They're just in a virtual format for the time being. If you'd like to receive emails about upcoming library programs tailored to your interests, topical book lists, or library news, visit thelibrary.org/newsletter to sign up for periodic updates. You'll be the first to know about library events and news, and the event emails also make handy reminders. Also want to let you know that this session will be recorded for sharing on our social media platforms, including YouTube, for those that weren't able to join us for the live event. Watch our channels for the link if you'd like to watch again or share with friends. And if you prefer not to be part of that recording, you're welcome to keep your camera covered or participate by audio only. This event is meant to be a conversation, so please feel free to ask questions as we proceed. There will also be time for questions at the end. Make sure you unmute yourself with the little mic symbol or in your Zoom panel if you'd like to ask a question. We're so pleased you could join us this evening for Advanced Care Planning Workshop with Pam Stoelzel. We hope that you take this opportunity to make some decisions for yourself that will be a benefit to both you and your family down the road. Pam has a wealth of experience talking with people about their healthcare choices and guiding them in the completion of healthcare directives, and is currently the program coordinator for Respecting Choices of the Ozarks, a partnership of several community organizations working to promote advanced care planning in the area since 2016. Thank you for sharing your expertise with us this evening, Pam.
Thank you, Sarah. So first of all, thank you everyone for joining us tonight. I appreciate that. I know it's a particularly busy day, being an election day, so I do really appreciate you joining us. Before I get started talking about advanced care planning, I want to again mention Hospice Foundation of the Ozarks and thank them. They are our original funders, and they really the organization responsible for helping us to get our organization, Respecting Choices of the Ozarks, off the ground. So we are truly indebted to them and very grateful for their assistance. So today, what we're going to talk about is really what is advanced care planning. We're going to reflect on your values and beliefs and talk about why that's important. We'll talk about how you can select a healthcare agent and the role of an agent. We'll talk about how you can express your wishes and how you can share your plan. Sarah mentioned that this is meant to be an interactive workshop, so if you do have any questions that you would like to ask, please feel free to do that, and I also will have time at the end for you to do that as well. So I'd like to start just by asking you to think about what you understand about advanced care planning. And if any of you would like to share with me, that would be great.
I understand it to be instructions on how you want to be cared for in a hospital, for example, if you were incapacitated or any reason, a car accident or whatever, that you let people know what you want, how you want to be cared for.
Yeah, that is great. Thank you, Melissa. That is an important part of what we talk about with the advanced care planning, is that notion of if I couldn't speak for myself, who would make the decisions for me, and would they understand what I would want those decisions to be? So great, thank you for that. What fears or concerns do you have about this type of planning?
My fear is that my wishes won't be followed.
Yeah, that is a really, really common fear. And we find that one of the best ways to make sure that that fear is not come to fruition is to have really in-depth conversations with those people that would be involved with your care, and in particular to have really specific in-depth conversation with a healthcare agent that you've chosen, and that part of the reason you've chosen them is that you know they will do as you want. So that is how we really encourage people to overcome that fear. There are actually, a huge number of fears and concerns people have about having these conversations. And I've been doing this type of work for a few years, and I've heard a lot of different fears, but some of the more common ones are, I don't want to talk about this because it will upset my family. That's a really common fear. Or another fear is, I don't really want to talk about this because I'm sort of tempting fate. Maybe something bad will happen if I talk about this. And so we like for people to think about their fears so that we can really talk with you how to overcome those fears and to have really full, in-depth conversations. The next question is, if you've completed an advance directive in the past, what do you hope the document will do for you in the future? And I don't know if any of you have completed an advance directive, but if any of you have, what is your hope that it will do for you in the future?
I hope it will guide my family if there is something that happens to me and I can't speak for myself, and that they will follow what I ask.
Yeah, absolutely. So, advance directives really contain two parts. One part is what we mentioned, the healthcare agent, or the legal term is durable power of attorney for healthcare. The second part of that document is actually the directive portion, or in other words, it's your chance to, in writing, direct your agent and direct your providers and the type of care that you would or wouldn't want in various types of situations. So let's talk a little more about what advanced care planning is. It is important for all adults, so everybody 18 and older. There's a misunderstanding that advanced care planning is really designed to be used with people that are, quite elderly or are very ill, or maybe even, nearing death. And certainly all of those categories should be involved in advanced care planning, but our hope is that people would do it much sooner than that they would start these conversations before they're at the point that they're having a medical crisis. And again, we do encourage all adults 18 and older to start thinking about and having these conversations. It's also a process. It's not a one and done. So you may start having these conversations when you're a young adult, but we would want you to continue throughout your lifetime to periodically think about and review your wishes. And if you've done written documentation, to review that to make sure it still accurately reflects your wishes. It does involve thinking and talking about future healthcare decisions. So it does involve that idea of being able to really sit down and talk with the people that you care about and that care about you, what your values and goals are for healthcare. One of the scenarios that we use when we talk about advanced care planning is the scenario that you see on your screen. If you had a sudden event like a car accident or illness and could not make your own decisions, and others would need to make decisions for you. The reason that we use this type of scenario is that often for people that are younger and healthier, it's very hard for them to sort of wrap their mind around why they need to have these conversations. But when we look at this type of scenario, most people, when they hear this, say, aha, I do know somebody that's been in that type of incident. I know somebody that had a car accident or an illness and they couldn't make decisions. And then it really brings it home for them, the importance of having these discussions, even though they are very young and healthy. You know, the unexpected can happen, and advanced care planning isn't only planning for when you're terminally ill, it's also planning for that unexpected event that could potentially happen. So we will, you know, as we talk with you, we would encourage you to explore your experiences and to reflect and to look back on what some of your different experiences are. Many of us have known or have heard of someone who was in a medical situation where they were unable to make or communicate healthcare decisions for themselves. And so I'd like you to think for just a moment about someone that you've known who's had a sudden illness or injury and was unable to communicate. And if you're willing to, share a little bit about that experience and what you've learned from that experience.
I'll share. My husband's, one of his aunts and uncles, both sadly died very close in time proximity to each other, and both developed illnesses where they were incapacitated and could not make decisions for themselves, and both ended up on some form of life support. And it was, as an outsider looking in, seemed to be a very painful death process, and it was painful for the family to watch, for the daughter that isn't local to not be able to be here and see and share that experience with her parents, or even help make those decisions with the medical personnel. It was just a tragic situation, and that really reinforced to me the need for advanced care planning.
Yeah, it sounds like it was a really impactful and difficult situation for everybody within that family group. But you're right, Sarah, often when we think about those types of experiences, one of the things that we often learn from it is it highlights the importance for each of us to have those conversations so that we can maybe not avoid those medical problems, but avoid some of that conflict and trauma that's involved for our loved ones when they don't know what decision to make. They don't know what we would want. So thank you for sharing that, Sarah. Another thing that we would ask you to think about is the notion of living well. So this is in addition to thinking about our past experiences. We find that it's helpful to think about activities that we engage in that are important to us and that give our life meaning. If you were having a good day, what would happen on that day? Who would you talk to and what would you do? Would anybody like to share what a good day looks like to them? So I will share on this one. I actually, a good day for me would be able to be kind of curled up in my favorite comfy chair and having my family kind of around me, but I'm able to sort of sit and do some activities on my own as well. So whether that be crocheting or reading a good book, it's that idea of being able to be both independent enough to be able to do solitary activities, but also having my family there if I want to, you know, engage with them and do activities with them. And that really sort of defines living well for me. It's that combination. The reason that we look at this idea is that often when we think about the activities and the events that make our life rich, those are the things that really define quality of life for us. And when we think about quality of life, those are things that often tie into the types of values and goals we might have for our own health care. It all sort of connects together. And a thing that you need to be aware of is that over time, this too can change. You know, I've had younger people tell me that living well absolutely included a lot of physical activity. So they were runners, they were marathoners, they like to be outdoors all the time, very physically active. But as they age, they may well decide that that's not something they can really keep up with, but that their activities may change slightly. So now it doesn't mean that they do marathons, but maybe it means they're able to go outside and take a walk. As they continue to age, it may mean that they're able to continue to interact with the people that they love. So this too can change over time as our own health changes and also as our experiences change and we have more of them. There's 3 decisions that we think it's important for everybody to consider when you're talking about advanced care planning. Number 1 is who would make medical decisions for you if you were unable to speak for yourself. 2 is identifying if there are values or beliefs, personal, cultural, religious, or spiritual, that guide you and may affect your treatment decisions. And 3 is talking about what your goals of treatment would be if you permanently lost the ability to know who you were or know who you were with. So let's explore each one of these decisions in just a bit more detail. One of the most important decisions we encourage all adults to make is choosing someone now who would make future decisions for you if you were ill or injured or unable to make decisions for yourself or communicate your wishes. This person would only make decisions if you had a sudden event and could not make your own decisions. And I want to stress that because we mentioned earlier fears, and one of the fears for a lot of people is that if they name a healthcare agent, they're suddenly giving away all ability to make their own decisions. That is not the case. You continue to make your own decisions as long as you have the ability to do that. And the agent's power is only invoked if you don't have the ability to do that, and if 1 or 2 physicians, depending on what you put on your documentation, decide that you do not have that ability. So we like to reassure people that it's really very safe to name a healthcare agent. You aren't giving away that ability to make those decisions. You'll also want to consider naming an alternate or 2, and this is just in case your first choice is not available. So let's say you have someone in mind to be a healthcare agent. The first thing that you would want to do is ask them if they are willing to do this. Okay, that's very, very important. And I will tell you that with advance directive documentation, the agent is not really part of the legal making of that document. They do not have to sign it. They don't have to witness it. So I could actually name Sarah as my agent and never even talk to her about it. I could put that in a document and make it legal. Okay, and then if something were to happen to me, Sarah might get a call because she's been invoked as my agent. Wouldn't she be surprised, right? And how helpful would it be to name her as my agent because I never talked to her about my wishes? So a lot of people, though, do that. They name an agent and they've never even really discussed it with them. So you have to make sure you talk to them and make sure they're willing. While family or partners may seem like a natural choice, it's important to talk to them about the role. Some people actually choose not to have family as their agents. Here's an example of that. I was meeting with an older couple, and they were both in the meeting, and the lady said to me, the wife said, you know, I've decided I'm not going to name my husband as my agent because I wouldn't want to be kept alive in certain situations, and I know he would never let me go. So I'm going to name my best friend as my agent. And she'd already discussed this with her husband, and he was well aware. And when I looked to him, he said, she's right, I would never let her go. So that's an example of when it may be appropriate not to name, you know, somebody that you're partners with or somebody in your family. Although it's not wrong to name your family either. It just has to be somebody that meets this criteria. You also want to ask them if they're willing to talk with you about your goals, values, and preferences. Whomever you choose, you want to communicate with them so that they know your current wishes and they know any changes to your wishes as your life circumstances change. We've all known those people that when you bring up this type of topic, advanced care planning, they sort of cover their ears and say, I don't want to talk about it. I don't want to hear about it. I don't like to think about it. That person may not be a great choice as your agent, because it needs to be somebody that's willing to sit and listen and talk with you about these issues. Third, you want to ask if they agree to honor your wishes, even if they are different from their own or different from what they would pick for you if it was just up to them. They need to remember and commit to you that they are speaking for you, not for themselves when they make these decisions. And fourth, your agent should be someone who is able to make decisions during difficult or emotional times. What I found through having these discussions with lots of different people is that often it's that fourth criteria, someone that can make decisions during difficult or emotional times, that sort of can break a tiebreaker for them. If they've got a couple people in mind that have met all the criteria up to this point, often we get to that fourth one and then they go, oh yeah, it needs to be Joe because he's a firefighter and he's great in an emergency. Or, oh yeah, it needs to be Susan because she's a nurse and she doesn't get overly emotional with this type of decision. So that is an important criteria to consider as well. You also should remember that the more discussion that you have with your agent and your alternate agents, the less chance and the less potential for conflict when they have to make a decision. I always tell people to think about if you were in this type of situation where you couldn't make your decisions known and your healthcare agent's powers had been invoked, who are the people that would show up at the hospital to see you? Probably, a lot of your close family, maybe close friends. Think about those people because you want to really include all of them in this type of discussion, at least to the point that you let them know who you named as your agent and basically what the type of care is that you'd want. This can really cut down the potential for there to be conflict. That healthcare agent's powers invoked, but nobody else has been told. They may have some disagreements about that. Well, mom never told me she named you as a healthcare agent. Mom never told me that's what she wanted. So if mom has actually told everybody, that cuts away the chance for that type of conflict to happen. Plus, those people can then support that agent and really support them in that still difficult role that they have of making those decisions. So next we want to talk about the type of spiritual, cultural, or religious or personal beliefs that you want to consider. So what cultural, religious, spiritual, or personal beliefs, if any, do you have that might help you choose the care you want or do not want? Are there cultural, religious, or spiritual practices that are important to you or give you comfort? And is there someone that you would like to talk to about these beliefs or concerns? We ask people to really think about this because if there is something that's important to you, you need to mention that to your agent so that they know. Now, nothing may come to mind, and that's okay too, but something may come to mind. An example might be somebody of the Catholic faith might say, it's really important to me that if I were dying or thought to be dying, that they would call my priest and I'd be given last rites. That's something you want to make sure you tell your healthcare agent so that they know and they can be an advocate for you in that time. But it could be something cultural as well, or just something personal. Maybe it could be something like, if I were in that type of situation, I would want the quilt my grandmother left me brought and laid over me on my bed. I would want that with me. That's probably not something your agent's going to necessarily just think of, So you need to tell them that type of information. And for some of these, especially the religious, spiritual, cultural beliefs, it may be that you would feel more comfortable talking to somebody within that culture or religion. So you may need to think about who would that be that I could go and talk to about these beliefs, and they could help me sort of determine how I want these done. Third is we want you to explore your goals for medical care. So this is when you're considering your goals for medical care if you've experienced a sudden illness or an accident that caused a severe and permanent brain injury, one in which it was unlikely you would recover the ability to know who you were or who you were with. So for this one, I'd like each of you to imagine this scenario. A sudden event, such as a car accident or illness, left you unable to communicate. You are receiving all the care needed to keep you alive. The doctors believe there is little chance you will recover the ability to know who you are or who you are with. So I want to make sure I explain the situation correctly. So in your own words, can you tell me what this situation means to you? So there's some key themes in this situation. For one thing, we know that the doctors believe you can be kept alive, but that you'll not recover the ability to know who you are or who you're with. They also believe that that chance for recovery is very minimal, and we tell people less than 5%, just to give them an idea of how minimal it is. I like to explain the situation by using the idea of thinking about a bridge to recovery. You know, if I had a stroke, but it was expected I would recover, I would need lots of help and probably many months of therapy. And I'd need all the therapies probably, right? The occupational therapy and the physical therapy and the speech therapy and the breathing therapy. I need all of that, but I would recover. I might not get back to 100% of where I was before the stroke, but I would improve over time. In the situation we're talking about with this sudden event, we don't believe there's any bridge to recovery. We do not believe that this person will improve, or the chance of them improving is very, very minimal, less than 5%. You also should know that while we can keep this person alive, we also would keep them comfortable, regardless of whatever decision was made healthcare-wise. So the next question is, would you want to continue medical treatment to keep you alive? Or would you want to stop medical treatment to keep you alive, remembering that in either case you would be kept comfortable? This is often a hard scenario for people to think about. And it may be one that you've never thought about before, so you may need to spend some time really thinking about what that would be like, and with your values and goals, what you think that you would want. I really believe that's the first step in advanced care planning, is to start processing this information for yourself. And then once you start getting an idea of what you would want, the next step is to then talk to that potential healthcare agent. So after you've had these discussions, what are the next steps? Follow-up items. Talking with your healthcare agent, and I know I've said that probably 100 times already, but it's so, so important. I think in healthcare, we tend to stress the document, the Advance Directive document. And while that's a beautiful document and we're always happy people complete it, what's much, much more important is the conversation. That document and naming an agent is virtually worthless if they've never talked with that agent about what their choices would be. So talking with your healthcare agent, your alternate agents, and really with those, again, those people that you feel like would want to be involved in your healthcare, to at the very least let them know who you've selected as your agent. You can also meet with a facilitator. A facilitator is somebody through our organization, Respecting Choices of the Ozarks, that's had pretty in-depth training to have these types of conversations with individuals and families, and if they wish, to help them to complete documentation. This is completely free. And we have a number of facilitators throughout our community. Anyone in Southwest Missouri that desires to talk with a facilitator can contact me and we can get that arranged. Again, it's free. And if they need more than one meeting, we're happy to do that as well. Once we help the individual or the family to sort of process advanced care planning, then we will ask them if they'd like to complete an advance directive. And if they would, we will certainly help them with that step as well. If you do complete an advance directive, the next step is to give copies to your healthcare agent and any alternates, as well as any healthcare professionals, remembering that in this day and age, every healthcare organization uses a different electronic medical record. So you might go to Cox for a lot of your care, but you go to Mercy for another portion of your care. You would need to give a copy of that document to Cox and another copy to Mercy. And then any other organizations that you go to, you want to make sure they have a copy of your document. Again, you'd want to talk to the rest of your family and close friends and tell them who your healthcare agent is and what your wishes are. You also want to keep a copy of your advance directive where it can be easily found. A lot of people put these documents in a lockbox. If you want to do that, I understand the idea of doing that to keep them safe in case there's a fire or anything, but make another copy that you keep somewhere where you can get to it quickly and have access to it if you need it. And then if you go to the hospital or you go to a nursing home, you'll definitely want to take a copy of your directive with you to provide to that hospital or skilled nursing facility. You'll also want to review your document periodically. I mentioned early on that this was not a one and done. It's an ongoing process. And as you age, your circumstances change, your healthcare will likely change. Your decisions and your goals and values for healthcare may change. So it's important that you review that document. We encourage people to review it every year when you have your physical exam. That's just sort of a good reminder that it certainly is an important part of your healthcare. And just like you go in for your physical exam and they send you for blood work, okay, and I also need to review my advance directive and make sure that it still accurately reflects what I would want. At a minimum, we would want you to review when any of the 5 Ds occur once a decade, so at least once every 10 years. If there's a death of a loved one, especially if that loved one was named as an agent or an alternate agent in your document. If you have a divorce, especially if that now divorced partner was named as your agent or your alternate agent. You may not want them to be your agent any longer, so you need to review that document. With a new healthcare diagnosis or with a significant decline in your health. When any of these events occur, we strongly encourage you to go back and review that document. So I mentioned getting in contact with me. My name is Pam Stoelzel again, and you see my number there. Janice Briggs is my co-worker, and she's also someone that you could contact for assistance and meeting with a facilitator. We can, if you are a Mercy patient and you'd rather meet with someone at Mercy, we have facilitators at Mercy, and I will connect you with them. We have them at Burrell Behavioral Health. We have them at Jordan Valley. We have them kind of spread out throughout our community. So please don't think that because I work with Cox that you have to meet at Cox. If you're not a Cox patient, that's fine. We will direct you to the person that can best help you in whatever organization that you currently get your health care from. So please do feel free to contact us at any time. So I guess now I'm at the portion where if you have questions, I would be happy to entertain those.
I have a question, Pam. Do you think that as more and more people understand what advance directives do, that it's more accepted now in hospitals and I think amongst families and family members than it used to be? Because I've been in situations or have been aware of situations where even with the the agent, the listed agent, trying to make the right decisions. You know, other people come in or family members come in trying to change those
Mhm.
because they either weren't aware of it or didn't feel like that was the right decision for their loved one.
Yeah. I do think we're slowly getting to that point where there's more acceptance, Chrissy. We're not where we want to be, though. You know, most people, when you ask them, they'll acknowledge that having these conversations and completing these documents are really important, but there's only about 25% of our population that has actually done that. Um, you know, greater than 75% say it's important. So, you know, there's kind of a mismatch there. I do think that with increased knowledge about that, we will normalize the discussion more. And while we see that conflict that you mentioned occur, again, how we can reduce the chance of that is by encouraging people to have those discussions, to have them more than one time, and to have them with all the people that might be involved in that type of situation. It sounds like what may have happened in that type of situation is that although they had an agent and maybe talked with their agent in a lot of detail, they likely didn't talk with all the other family members and other loved ones. And so when they showed up, it was all a big surprise to them. We want to make sure that these conversations are not a secret. We're having them with lots of family. I have a little joke that, you know, advance directives are a great thing to use as a placemat at Thanksgiving dinner. But we do want to have these as family conversations as well as have those discussions with the healthcare agent.
Two scenarios for you,
Okay.
Pam.
Yes.
So as I had happen, I filled out my advance directive and took it into my doctor's office, and they didn't know what to do with it. So what do you advise for people when they do take in their advance directive to their doctor?
Yeah, so it should be scanned into your medical chart. And if your doctor says, I don't know what you want me to do with this, I would encourage you to, you know, ask the office manager there, you know, see if, because likely they will know that it goes into your it gets scanned into your medical chart. That would be my guess there. The physician isn't usually the one scanning that stuff in. So
The office managers know it all.
they, you know, they do run the place, honestly. So
Yeah, they
I have
do.
I have all the respect for them. So yeah.
So the other is say you have an advance directive in place, or your loved one does, and you go to, let's say you're in Mercy for treatment, and you take in your respecting choices advance directive, and Mercy says that they won't use that document, but this is a community document, correct?
It is a community document, and I'm glad you mentioned this, Sarah, because it has been vetted by our attorneys. It's actually the Cox Health preferred document now. It's also the preferred document at Jordan Valley Health and at Burrell Behavioral Health, and Mercy has also agreed to accept it. So it is a community document. If you run into somebody that says we can't accept that document, one thing you could do is just call me, because I'm happy to help, you know, kind of troubleshoot in that situation. But again, I would ask someone else there as well. You know, this is a document that I have and I would like to use this, or it's done and I would like to turn it into their charts. Other questions?
What if you decide you don't want somebody to be your healthcare agent anymore?
Yeah, so these documents are not written in stone. If you change your mind about, you know, a variety of things, it could be who you want your agent, we would ask that you complete another document, update by doing a new document, naming a new agent. And how organizations use documents is that they file them by date order and they use the most recent one done as the valid document. And actually within the documents, they have some legal language that says that all previous documents are null and void. So the most recent document completed is the one that they will follow.
So do you see any reason to notify someone that they're no longer your agent if they had been in the past?
Definitely. I would let them know that you've changed your mind and you've named Susie as your agent now. And of course, certainly I hope that you would have notified Susie of that and made sure Susie was willing and had discussions with her. But you'd also, again, want to tell all those people in your circle, you know, I want to let you know I changed my mind. My agent now is Susie. I really want you to support her if she's ever, you know, has to make a decision. And these generally are what my choices would be.
If someone then takes this further step and creates a living will, does that then supersede their advance directive?
So living will is kind of an older term that we don't really use a lot now. It's a document that came around came around in the 80s, and it was used for people that had terminal conditions, and they would use a living will to state very specific interventions that they would or wouldn't want. If somebody has a living will and that, you know, that's what they present, it's still accepted. But if whatever they've done most recently is what's going to be referred to, and the living will probably wouldn't have been done very recently because now they use advance directive forms. I hope I answered that right for you. I hope that
I
made
think
sense.
so.
Yeah. Other questions?
I have a question.
Yes.
Can you provide some language for approaching parents, for example, just opening up the discussion, asking the question, have you all thought about this and what can we do to help? My parents, for example, they're well, but they're up there, and but they're very private and proud people. So we've never had discussions like this, and I don't know, you know, can you provide some language for starting that discussion?
Yeah, absolutely. Thanks for the question. This is a really common scenario for folks and a common problem that they experience. So since you're at this workshop, I would encourage you to say to your mom and dad, hey, mom and dad, I was at this really interesting workshop that was talking about advanced care planning. And I started thinking about the fact that we've never really talked about these issues. And that if something happened to you suddenly with your health, I wouldn't have any idea what you would want. And it makes me feel really uncomfortable and scared. And I would feel so much better if we could have a little bit of discussion about that. And that hopefully will open the door, especially since the way that you're phrasing it is that they're really doing it for you, right? Because you're uncomfortable, you're afraid, and you're asking them to do this for you, to help you feel better about this. We also have some written materials that if you would ever want us to send out to you, we'd be happy to do. We have an advanced care planning brochure, which actually has a list of different types of questions or kind of starter questions for the conversation. And then we have another document that talks about in detail the role of a healthcare agent and those qualities that we want to look for in an agent. I hope that that helped, Melissa.
Yeah, I thought it was great.
Other
Good advice.
questions? Well, in the future, if you do have questions, or you would like to meet with a facilitator, or you would like material sent to you, please just call me. You see my number there, which is the 269-3903. Again, I'm very, very happy to assist you with any of this.
Thank you so much, Pam. We really appreciate your time this evening. Under normal circumstances, we'd all be applauding right now. So thank you for sharing this important information and giving us all so much to think about. And thank you again to our viewers for joining us this evening. We hope you'll join us for our next event about social model end-of-life care homes at 7 p.m. this Thursday, November 5th. Find a link to the event and the series schedule and titles for suggested reading. Again, that's thelibrary.org/death, and visit thelibrary.org/programs to see the full schedule of library events this fall and coming up this winter. Thank you all very much and have a good evening.
Thank you.